Hi, welcome to the Brain and Eye Institute's Patient Education video series. In this video, we're going to talk about idiopathic intracranial hypertension, or IIH. By definition, idiopathic means unknown cause, intracranial inside the brain, hypertension, high pressure. So, increased pressure in the brain due to an unknown cause. This, if untreated, can result in permanent vision loss, and it's associated with obesity, especially in females of childbearing age. The old term that used to be used for this is pseudotumor cerebri. It's a little confusing term, so it's no longer being used. What is currently used is IIH, idiopathic intracranial hypertension. There are several causes of increased pressure in the brain. I have a few examples here in this slide for you to take a look at. In the middle one here, this brain has a tumor, which is this white round object here. This can cause the pressure to be high in the brain. In this example on the right here, we have somebody with obstructive hydrocephalus, which is a situation where the ventricles, these things that I'm pointing my cursor around, the ventricles that produce the cerebral spinal fluid and have that fluid flow through are obstructed. They can't drain, and therefore the pressure increases and it has this appearance on MRI. On the left here, we have an example of the veins that drain the brain. And this is a situation where this patient's veins on the right side were clotted off, and therefore only half of the veins only on the left side are able to drain the brain. As you can imagine, due to a drainage problem, the fluid backs up and the pressure becomes elevated. There are a lot of causes of increased pressure in the brain, but they all need to be excluded in order to get the diagnosis of IIH. Now, according to the Idiopathic Intracranial Hypertension Treatment Trial, the majority of patients, upwards of 80%, had headaches, which is a very common symptom. However, patients with IIH also commonly had other symptoms that people usually don't pay attention to, like, for example, transient visual obscurations. More than 2/3 of patients with IIH are expected to have this, where there's a temporary, transient, visual obscuration or blurring of vision. There's an obscuring of the vision that occurs. About half of the cases will have pulse synchronous tinnitus. This is described by patients usually as hearing their heartbeat in their head, or a whooshing, blowing sound that pulsates or is in synchrony with their heartbeat. About a third of the cases had peripheral vision loss, which is unfortunately oftentimes, if not treated right away, can be permanent. About a quarter of the cases or so, or 20%, had tinnitus, which is just ringing in the ears. About 20% had double vision. And here's the part that makes this disease entity very difficult and challenging, is the fact that the majority of cases, the majority of patients that have IIH will have perfectly normal central vision, 20/20. And that makes it really hard for the patient to realize that they even have a visual problem to start with. What I'm showing here in this slide is the outline of the ventricular system and how I'm going to talk to you about how the cerebral spinal fluid is made and how it flows out. So these cells here are known as the choroid plexus, and they're found inside the lateral ventricle, which you can see on this cartoon here, these horn-looking like things, like ram horns. This is, by the way, in everybody's brain. If you have a normal brain, this is inside there. And these choroid plexus cells produce the cerebral spinal fluid. Now, this cerebral spinal fluid flows down into the third ventricle, and then down the cerebral aqueduct into the fourth ventricle, and then down into the spinal cord, and then out into the sinuses of the brain, where it's then drained into the jugular veins and then back into the heart. Now, this is the production of the fluid, and it goes down this way. Anything that increases the production of this fluid, or if it's produced faster than it's being drained, can potentially cause the pressure to be high. Now, what occurs is when the pressure is high in the brain, it puts pressure on the optic nerves. And what you see as a result in this test here, which is the visual field, you see that the blind spots, initially in mild cases, will become enlarged. This is kind of one of the first signs you would see on a visual field with somebody with IIH. Now, a more advanced case you can see down here where there's this tunneling of vision, where all the dark areas are areas where the patient can't see. Interestingly, the center vision is usually spared. And this tunneling of vision takes place very slowly over weeks to months and sometimes years. And so the patient becomes kind of adjusts to it, doesn't maybe even notice that they're having a problem with their peripheral vision, and their central vision is 20/20, and so it could go undetected for long periods of time. The natural history of the disease is untreated cases, about 10% to a quarter of the cases, will have severe permanent vision loss and sometimes blindness if not treated appropriately and early. The vision loss is very gradual. And so this is not something you expect to see like all of a sudden a change, and then you go to the doctor and you say, yes, I had a vision change and I'm having a problem. Please help me out. This is something that oftentimes becomes overlooked. And patients usually report the other symptoms like the headaches, the transient visual obscurations, where they're getting temporary episodes of blurry vision, pulsating sound in the head, those kind of things. Now, in some cases, if the pressure is high enough and the optic nerves are swollen enough, you can have permanent vision loss take place over weeks. These are usually cases that we describe as malignant and really need to be intervened on as soon as possible. The modified Daniel criteria is what's used by neuro-ophthalmologists to diagnose IIH. And the criteria include signs and symptoms of IIH, which we described, the headaches, the transient visual obscurations, the pulse synchronous tinnitus, could include double vision. The examination, the neuro examination, should be normal, except for some causes of double vision, usually a sixth nerve palsy. Could be either on one side or both sides. Now, this is a very important point here. The only way to know what the pressure in one's brain is to actually measure it. You can't measure it with an MRI. You can't measure it with a scan. The only way to measure it is through a lumbar puncture, which is a needle in the back. It goes in the lower part of the back, and it's advanced into the spinal canal, and the fluid is taken out, and the pressure is measured. Importantly, as part of the modified Daniel criteria, this fluid, or the cerebral spinal fluid that's collected, needs to also be analyzed to make sure it doesn't have any kind of inflammatory cells or infectious causes that may lead to the increased pressure in the brain, or any kind of cancer or something of that nature. And the MRI of the brain needs to be normal. No hydrocephalus, no mass, and completely normal looking brain. Just like we saw how earlier on there are other causes that can cause the pressure to be elevated in the brain. All right, now the treatment approach for IIH really is to get ahead of the disease process. You really don't want to play catch up. And that's the issue with physicians who are not experienced with handling IIH. Typically, neuro-ophthalmologists are very well experienced in this. And so other specialty physicians may not be, and they play catch up. And this unfortunately leads to potentially, and I've seen this too often for me to like to admit, is they play catch up and patients still have swollen optic nerves over weeks and months, and then they have permanent vision loss, unfortunately. The key here, what was found in the IIH treatment trial, is typically weight loss of about 10% of one's body weight takes care of the problem naturally. Now, of course, weight loss is very difficult, and 10% of one body weight is a significant amount, and it doesn't happen right away. And so, in the meantime, what we usually recommend is treating patients with medications. And if that doesn't work or if it fails, the plan B option will be to have surgical intervention. Now let's talk about a couple of cases just to kind of give you a better idea of what patients usually go through when they have IIH. This first case, a 36-year-old female with obesity who had childhood onset headaches. So she's had headaches all her life that she can remember. And so it wasn't something that caught her attention because she's always had headaches. Now, she came in because she recently started hearing a heartbeat sound in her head. She thought that was kind of unusual. And then she also mentioned that more recently she started noticing cars coming out of nowhere while driving. Now, that is a very important sign to pay attention to because that's an indication that this person's peripheral vision is probably compromised. Now here's a picture of this patient's eyes, and I wanted to show you this so you have an idea what swollen optic nerves look like, or disc edema. This yellow structure here is the optic nerve, and this is the right eye, and this is the left eye, the optic nerve of the left eye. Now, normally the optic nerve is, or the optic nerve head is what we're directly looking at here, is nice and round, and the edges are nice and crisp. And you can see the retina right here next to it and the optic nerve, and you can see the difference very clearly. Now, in this case here, where my cursor is on the top nasal side and the bottom part of the optic nerve, you can see how the edge of the optic nerve is not clear. It's obscured by this kind of basically this is the swelling, so it's obscured by this swollen optic part of the optic nerve. And this is actually fluid from inside of the damaged pressurized axons or nerve cells of the optic nerve. These cells burst and the fluid that's in them comes out, and this is what you see. It obscures the edges of the optic nerve. And this is the left eye. It's the same kind of thing. On the temporal side, right here where my cursor is, you can see the edge of the optic nerve, very nice crisp edge. And then on the top, bottom, and the nasal side, you see this obscured, hazy swelling of the optic nerve. Now, this is usually this appearance is, in this case, was a mild case. And we treated her with medications, and she lost weight over a few months, and she did fine. She had no more symptoms whatsoever, and her optic nerves returned back to normal. Second case, this is a more severe case. This is a 31-year-old male. He had a new onset headache, blurring of vision in both eyes, ringing in the ears, and transient visual obscurations, where he has these episodes where the vision becomes even more blurry at times, typically provoked by coughing, sneezing, laughing, bending over, or getting up from a bend. Now, in this case, I want to show you these optic nerves here. This is this patient's left eye before treatment. This is a severe case. You can't even tell where the optic nerves is almost. That round coin-like shaped optic nerve head isn't even apparent. You have this immense amount of swelling that's just hazing, obscuring the blood vessels, nearly obliterating the normal structure of the optic nerve. This is a very severe case. Now, the right eye of the same patient, it's pretty bad, but not quite as bad as the left eye. You can see the swelling, you see the haziness on the edges there. You can't see any crisp edges of the optic nerve. And so this patient I treated with medications and I escalated very rapidly. However, he did not show significant improvement initially, and so we had to go through a surgical intervention. But fortunately, after the surgical intervention, he did excellent. This is a picture of the optic nerves after the treatment, and you can see how now the optic nerve head structure is very apparent. It's nice, round, circular, sharp edges. Same thing on the right side. All that haziness and swelling went away. Just to kind of compare that again, you see that severe amount of swelling and then how it improved dramatically after treatment. These are the visual fields of that same patient. He had enlarged blind spots in both eyes, and then after the treatment, the blind spots went back to normal size. This is what you expect any healthy person to have. Nice looking visual fields. So, in conclusion, if you find out that you have optic nerve swelling or disc edema, or if you have headaches, episodes of blurring vision, pulsating sound in your head, please seek care at a neuro-ophthalmologist as soon as possible. You might have IIH, and if you don't get treated quickly, you may potentially have permanent vision loss. Seeing other specialists to take care of this problem, from my experience, has led to delay of proper care. And that has oftentimes, unfortunately, led to permanent vision loss. So if there's one thing that I'd like you to remember from this presentation is, if you have any signs or symptoms of IIH or swollen optic nerves, if your optometrist sees something about your optic nerves or ophthalmologist, seek a neuro-ophthalmologist as soon as possible. Thank you for listening to this educational video about IIH. I look forward to helping you in the future in any way I can, and you have a great day.